My name is Dr. Malau M. Toma. I'm the head for cardiovascular and tobacco control in the Federal Ministry of Health and Social Welfare Department of Public Health, Non-Communicable Disease Control Division. So we are here to join the global community to celebrate World Hypertension Day. So hypertension, sometimes called high blood pressure, is sustained elevated blood pressure, and it's a silent killer that kills, creates complications to people. So the best way to prevent it is to ensure that you are armed with adequate knowledge for you to ensure that the blood pressure is controlled through screening. For those that have the condition, they are placed on medication prescribed by healthcare workers. And as soon as you are placed on medication, the person is required to take his medication consistently, adherently, without break in taking of the medication. Otherwise, the blood pressure will not be controlled. And we have seen instances whereby when the hypertension is controlled, people tend to abandon their medication, and that is not good. Once people abandon their medication, the blood pressure can rebound back, and fatal complications can set in. Complications like stroke, heart disease, kidney failure, blindness, and the rest. And we don't want anybody to come down with these complications. That is why we are creating awareness on hypertension. Yeah, hypertension, awareness creation is an ongoing process, and social behavior change comes with intense awareness consistently. And people tend to forget, and people tend to be surrounded with a lot of issues around myths and misconception around hypertension. Some tend to believe that, oh, it's somebody that is doing me, which is not true. So people need to live healthy, engage in adequate physical activity, avoid unhealthy diet, avoid tobacco and nicotine products, avoid alcohol consumption, and eat healthy, a lot of fruits, spread over the day, and reduce intake of fats and oil. Yeah, government is not resting on its hours. Government is working consistently in awareness creation, and government has rolled out laudable policies, guidelines towards detection, management, and prevention of hypertension and related complications. A lot of them. And our primary health care are being, strengthened to provide that first level of care for the diagnosis and management of uncomplicated hypertension. And as soon as complication sets in, they refer those cases to higher levels of care.
Unfortunately, a lot of our communities are not aware of this hypertension and its complications. And as Dr. Malau mentioned rightly, we have now, as government, with our partners, taken the fight against hypertension to the doorstep of almost every Nigerian. How do we do this? By ensuring that primary healthcare centers are now fully armed to be able to manage simple, uncomplicated hypertension. For them to manage this, it means there is creation of awareness within those communities. It's not enough. We are doing more. We'll do more. But we have made a lot of progress from where we were some 5, 10 years ago. And our call to the general public is people, whenever you are not feeling well, go to the closest primary healthcare facility near you. Some of these facilities have been revitalized using the support from World Bank, from impact projects, and so on. And the federal government itself has done a lot of support through the Basic Healthcare Provision Fund. In fact, the Basic Healthcare Provision Fund is expanded in the BSCPF 2.0 to be able to do so much for Nigerians. What that means is our primary care centers are now ready to be able to create that awareness that we want in terms of hypertension or other non-communicable disease, and they can manage this simple uncomplicated case. Where there is complication, they will be able to detect and refer appropriately to a secondary or tertiary facility that is closest to them. So these are some of the things we are doing. So our own call to general public is to patronize these facilities. We should not sit at home and do traditional medicine, to do babalao, to go to prayer warriors and so on. These are some of the things that we have seen in the past and is complicating. Because if you go to all these prayer houses, Babalao, Imam, whatever you want to call them, and then you tend to develop serious complication. If you come to the base of centers, there's little or nothing they can do. So this is what is happening now. Hypertension gives us one of the most easiest tools for monitoring. As you mentioned, the BP check is one of the tools we use for monitoring. There are other advanced tools that are used in some equipped comprehensive PSCs as well as secondary facilities. But common BP check is the most simplest thing almost everybody can do, especially for people that are above 50 and those that have signs and symptoms or family history of hypertension. They should be able to check their blood pressure at least once a week. We know it's not easy. Even if you don't have the equipment at home, you can go to your facility. There are over 9,000 primary care facilities spread across the 774 local government of Nigeria. What that means is every ward has a comprehensive functional PSC that you can walk in and check your blood pressure on a regular basis. We will not say everybody must do that, but BP is supposed to be checked regularly by every adult from the age of 18. However, we know that people are limited by time. They have to go for commercial activity to get sustenance. However, every individual should be able to check his blood pressure at least once a month. It's free. All the primary care facilities offer this for free. And for those that are comfortable and buoyant enough, you can procure your own unit and keep in your own house. And you can be able to now check your BP if you want, even on a daily basis. There's no harm in checking. So it's very, very important. It's the first sign that will show you whether you are having signs that will lead you to complications of hypertension. Normal blood pressure should be less than 140/90 millimeters of mercury. And thank God that now we have a lot of digital equipment. They are self-administered. You can lie down. We have wristwatches that are measure blood pressure. We have so many devices that we can now use to monitor your blood pressure. But it's very, very important. It's the single most important tool to measure and prevent complications of high blood pressure. My name is Dr. Suleiman Lamurde. I'm the head of non-communicable disease unit of the National Primary Healthcare Development Agency.
The message is very clear. From all that our government representatives have said, it's obvious that the government is doing so much to bring down the impacts of hypertension and other non-communicable diseases on the health system. But a lot still needs to be done. They still need a lot of support, and that's why we are here. There are several partners currently working with the Ministry of Health to catalyze progress and ensure that we bring down this scourge. One of the key messages or one of the key supports that partners are providing is to support the Ministry of Health to reach out to the leadership of the country, especially the Ministry of Finance, the presidency, to also send that message of awareness to them on what hypertension and other non-communicable diseases are contributing to the health system and the reason why we need to prioritize action and create strong commitment to address this issue. And one of the ways that the leaders, our leadership from across can help to support this work is to improve funding for hypertension programs. We want to see a situation where we have programs that were created for HIV/AIDS, for malaria, also created for hypertension and other non-communicable diseases. This will ensure that all the MDs, especially Ministry of Health, that are implementing programs and activities around hypertension have access to the resources they need to do their work in terms of making available materials and services for screening, for diagnosis, for treatment and long-term care for hypertension patients. Part of what we're also doing is to work with patients, the patient communities, to ensure that they are linked to facilities, their voices are heard. Some of them are already telling their lived-in stories as per what they are experiencing with the fact that they are living with these diseases. So a lot of things are currently being done by partners all over, advocacy efforts, technical support to the ministry, and what have you. All we are doing, or all we are saying is that
let's work together. Let's support the government to ensure that we bring down the scourge of hypertension and other non-communicable diseases in Nigeria.
My name is Dr. Onyeka Sabiku, and I work for Resolve to Save Lives. Currently, we partner with the government of Nigeria to support and provide services to across two states in Nigeria currently, Kano and Ogun State, where we have worked with the Primary Health Care Development Agency and the State's Ministry of Health across the states with direct support from the Federal Ministry of Health to make sure that the policies are available within that state, providing a conducive environment for the implementation of the Nigerian Hypertension Control Initiative, which is being led by the Federal Ministry of Health. The government has been supportive. The initiative came to bear about less than 5 years ago, and we've spread across these two states, and opportunities are currently existing depending on also the willingness from those other states to expand the support across the other states, the 36 states in the country. Like the representative of the government had mentioned, that hypertension is a silent killer, and this year the team being controlling hypertension together, we are meant to work together from the government side, we as also stakeholders and partners working with them, and as well even also the persons with lived experiences, that are the hypertensive clients, to ensure that we defeat hypertension, we control hypertension as a country. And like has also been mentioned, every person above 18 should ensure that they get their blood pressure checked, and it's something that is a vital sign that prior to seeing any health worker is checked. So on picking that, like we've mentioned, greater than 140 and a systolic and greater than 90 should be referred for treatment. So it's something that is ongoing across the country. While, like we would always say, Oliver Twist, and like my colleague has also said, we want this program to also be large and expansive, like services have been provided to other communicable diseases. We're also hoping that and looking forward to support from the government, both an environment that is conducive to implement and also to sustain what has been started. Looking forward that the government provides the necessary support and funding also, so that we can expand, and across the 36 states, what the two states are currently enjoying, they can enjoy that as well.
And agencies which are part of this coordination mechanism to ensure the coordination and control of NCD. This include the Ministry of Education, Ministry of Environment, we have housing, we have various stakeholders, various agencies, we have NEMA. It's actually a very robust coordination mechanism where we come together to discuss where various stakeholders are doing in the control of NCD. Here we've been able to identify that even various military partner and agency have policy documents, and they have line activities that actually addresses the control of NCD. We have section where we come together to the technical session, where we come together where various focal person from these MDAs discuss what they're doing in line with the control of NCD. So we have multi-sectoral focal points in the various line ministry departments and agencies. This is to ensure robust coordination to address NCD, based on the fact that the control of NCD does not only lie in the health sector, but it lies across various MDAs, both the health and non-health sector, and to ensure a robust coordination and control of NCDs in the country. And also, we are also trying to replicate this in the states, where we have a coordination mechanism for the 36 states ministry and agency. We have focal persons where we are trying to encourage the states to also imbibe what we have at the national, to ensure that they have state level NCD multi-sectoral approach to control NCDs in the country. I'm Bumi Ruth Oshundele.